In Sydney, wildlife carer Kristen has brought 1-year-old Wallaroo Evie to see Audrey.
Hi, Kristen.
Oh, hi, Audrey.
Evie,
How are you?
good. How are you?
Oh, look, not too good.
Not too good. The face looks good though.
It's much better.
Evie was found a while ago standing in the middle of a paddock, disorientated, alone, and we don't really know how she ended up there, but she had these nasty wounds and fractures. We have a few theories about what may have happened to Evie, and I think fox attack is high on the list. When I first saw her, we were focusing on the broken arm. We managed to splint that, get it to heal, and then we noticed that she had some weird scars and scabs all over her face, which turned into massive abscesses. So we got her through that journey. We did a general anesthetic, drained her face, reconstructed most of her nose, and it's been smooth sailing for the last couple of months. And let's go into the console and have a look. Come on in.
Thank you. So, here we are.
Here we are. All right, Evie.
There's a huge lump in her groin. Oh, come on, sweetie.
Okay.
So you,
Move that away.
come on. When she stands up, you can see the bulge as well.
Oh gosh, it's huge. So Kirsten, when did you first notice this lump?
I think maybe beginning of this week when she didn't want to finish her bottle. So I put her on my lap and then I saw suddenly, oh, there's something sticking out.
It's a massive lump on the inside of her leg. I'm blown away with the size. I don't know where this has come from. It feels firm, it feels warm. I'm just baffled as to what it could be. Could it be something like a hernia, so a tear in the muscle, an intestine or fat is coming through? Could it be a tumor? Could it be a cyst? Okay, oh gosh, it is huge. Oh no.
In Sydney, a large lump has suddenly appeared on the inside of rescue Wallaroo Evie's leg. Audrey is concerned that it might be a nasty hernia or tumour.
You want to go back in your bag? I'm making a bit of a plan in my head because I don't know exactly what's going on. Have a bit of direction, but I need more diagnostic tests. And if it is good at the moment, it can turn pretty nasty quite quickly because anything that's out of the body cavity can essentially die off or become constricted. So I reckon we'll try and take one x-ray, just rule out it's not connected to anything like bone or pelvis, and then probably just open up the skin and have a look at what's underneath there. So I'll take it to the back
All right.
and give you a ring when she's in recovery.
Of course, I'm concerned that she's undergoing another anesthetic, but I really hope that she's coming good the other end. It is heartbreaking to see the suffering, but we have to tackle it, we have to address the issue, and the sooner we do it, the better it is.
Here we go again, hey? Here we
got
go
it?
again, yep.
Just clean up this stuff.
All right.
All right, I see you later.
Hi, Mama.
Take care, little girl.
Brave girl. Hey, we'll see you on the other side again.
Okay.
Evie's had some sedation, so she's nice and relaxed. I've got her on the x-ray table to have a better feel. And it's still baffling because even though she's relaxed, this lump is still huge. It's not falling back into a hole. I don't even know what that is now. Feels really hard. No idea.
Audrey's hoping x-rays will help shed some light on the mystery lump.
All right, x-rays. X-rays are up and I can see this cloudy lump where it is, and it's a puzzling mystery. Okay, so we know it's either soft tissue or fluidy. It doesn't have gas in it, which makes it less likely to be intestines. I don't know.
In Sydney, x-rays on rescue Joey Evie's mystery lump are inconclusive. Audrey's worried the lump could be a constricted hernia, or worse, a deadly cancerous tumour.
Only option now is to really do some surgery, open it up, have a look at what's going on, get a better idea. Okay, all right, moment of truth. Let's find out what's going on. What are you? Peekaboo. I don't know what it is. Massive ball of muscle. So it's not intestine, it's not bladder, it's not a cyst. All I'm seeing is a bulging piece of muscle. I'm gonna do a fine needle aspirate and see what we get out. It's pus. Oh my god, there's a giant abscess in her muscle. Oh my gosh.
In Sydney, Audrey's shocked to discover the huge lump on rescue Wallaroo Evie's leg is a massive infection in the muscle. It needs to be drained urgently before infection spreads around her body.
Abscess drainage surgery is my ultimate favorite surgery. Nothing more rewarding than all this pus and infection coming out of the body. So today, dream come true, I get to pop it, get that pus out, and have a look at that thick caseous infection. We're into the abscess because it's too... Oh my gosh. It's yeah, very smelly. This is one of the grossest abscesses I've had to drain. There must be about 150 mils of this thick green pus sitting in muscle. I think she's going to feel a lot better with that out of her body. We'll culture that, find out what bacteria is in there. Wow. Wow, Evie, just wow.
The amount of deadly pus trapped in the muscle is staggering.
There's more. Oh my God. So I've drained out all of the pus, given it a good clean, stitched it up, and now we can wake her up and get her home to mum. Okay, antibiotics done, flush done. Wake up, baby girl. Good morning. Yes. What's happened? Something's happened. Hey. Yeah, you're gonna be a little bit sore. You got a nasty infection out of your leg. You made it through surgery. You're going to be feeling a lot better.
In Sydney, wildlife carer Kirsten is anxiously waiting to collect her little Aussie battler, Evie.
Hi, Kirsten.
Oh, hello.
Look who's waking up. Say hi, Mama. It was a long surgery. Okay, let's get you in the consult room. Tell Mummy what we found. Okay. We'll pop you down here. We're still waking up, still very groggy, but everything's gone very well. So, Mum, I'll show you the wound, and I'm going to tell you it was not a hernia. See that the lump is gone now, so that's the incision there. We had to cut open the muscle. It was an abscess.
An abscess.
And it was sitting right between her muscle fibers. I've never seen anything like this before. So we actually cut open the muscle, and then there was this big cavity where all this pus was sitting, and it was just probably about 150 mils of pus.
150 mil.
So she's got an infection within her muscle. It could have been a bite wound. And I think the reason why it only popped up now is because we've finished the antibiotics for her face. So good news is all the pus is out. We've really flushed it out. I've given her an antibiotic injection. I've got the swab because I'm going to send it off and find out what type of bacteria is in there, because we want to give her the antibiotic that treats that infection so it doesn't come back. All right, Evie, you be good.
Thank you so much.
Yes. No more nasty surprises.
If you wouldn't have reacted, or if you wouldn't have intervened, what would have happened?
I would have gone to the bloodstream really bad.
Yeah. No chance then.
That was one of the nastiest abscesses I've seen.
Thank God to vets like Audrey. With their help, we can get the animals hopefully fixed up. Evie's really a fighter, and hopefully we get her through this problem now. Oh, thank you. I just carry her like that. Oh well, it is what it is.
It is.
That's what we do for the animals.
It is. Yes.
Okay, thank you.
All right.
Bye-bye. Bye.
Bye.